Hey everyone, thanks for joining. We will begin at exactly 1 p.m. Eastern Time. Hello everyone and welcome to today's session. This session is about loan repayment featuring Christine Pollitt. Christine serves as Executive Director of a nonprofit organization called the Southeast Pennsylvania Area Health Education Center, whose mission is to improve access to primary care in underserved communities through education and workforce development activities. She works with regional health providers in the Southeast Pennsylvania area and has a master's in public health. Please welcome Christine Pollitt to the stage.
Good afternoon, everyone. Alexis, thank you very much for the introduction. I'm going to go ahead and start sharing my screen for the presentation. All right, great. Again, Alexis, thank you for the introduction. My name is Christine Pollitt. I am the Executive Director of the Southeast Pennsylvania Area Health Education Center. I'm going to talk a little bit about AHECs and what they are, because all of you have AHECs in your regions that you can connect with. And then I'm going to be talking about loan repayment opportunities that are available and exploring some of the options that exist. So before I start talking too much about loan repayment, I'm just going to give you a brief overview of what AHEC is and what AHECs are. AHEC stands for Area Health Education Center. It's a national program that began in the 1970s in response to physician shortages, primarily in rural communities, but has since expanded to include a mission to serve and provide care in all of our underserved communities, whether rural or urban. So as I just said, the mission of AHECs is to increase access to primary care for underserved communities through education and workforce development activities. All AHECs are funded through the federal government through an agency called the Health Resources and Services Administration, which is referred to as HRSA. And what do AHECs do? So every AHEC does something different, but for the most part, AHECs offer community experiences for health profession students, particularly focusing on experiences with underserved communities. We offer pipeline activities, which is programming for middle school students, high school students. Maybe some of you participated in a health careers club or went to a health careers camp that inspired you to consider exploring the field of healthcare as a profession. For folks who are already practicing, we provide some continuing education opportunities. We have community health worker trainings, and we also have something called the PA AHEC Scholars in Pennsylvania, where I'm from, but the AHEC Scholars across the country, which I'll talk about a little bit more towards the end of the presentation. There we go. So before I get into some specifics, just some kind of loan repayment 101 information. So loan repayment opportunities are available through the federal government as well as through many state governments. There are both scholarship and loan repayment programs for a variety of health professionals for providing, who are providing care in underserved communities. So why does the federal government or the state government offer these opportunities? So these programs are designed to be incentives to ensure an adequate healthcare workforce in underserved communities. As we talked about just a moment ago, that's the whole reason AHECs were developed, were to, in response to provider shortages in these underserved communities. So what these programs do, it's basically a payment of education expenses, if it's in the form of a scholarship, or repayment of loans in exchange for a certain amount of time in an approved site. And to clarify, any scholarship or loan repayment benefit is in addition to and separate from a regular salary or compensation from an employer or from that employment site. All of these programs are competitive. They're based on need, priority areas, the amount of funding that's been set aside in the budget, and then qualifications of the individuals who are applying. So it's not something that you apply and it's guaranteed. It is a competitive process. So before I get into some of the opportunities that are available, there are some definitions that are worth kind of knowing and thinking about. So HRSA, the Health Resources and Services Administration, has something that's called a shortage designation. And a shortage designation identifies a geographic area, a population, or a healthcare facility that is experiencing a shortage of healthcare services or providers. There's different types of shortage designations, and these are important to know because this can impact the competitiveness or the ability to apply for some of these loan repayment programs or to fulfill the obligation of a scholarship program. So the main types of shortage designations defined by HRSA, the first one is called a HPSA, federal government, lots of acronyms and words shortened into things that you're not sure, do I pronounce the letters or do I make it into a word? So that's a health profession shortage area. So that's called a HPSA. I'll go through and define these in a minute. There's also MUAs, which is a medically underserved area, and then there's also medically underserved populations. Those are the two that I will define in a moment for you that are most important when we're thinking about some of these scholarship and loan repayment opportunities. There's also something called an exceptional medically underserved population. And there's also a governor's designated secretary certified shortage area for rural health clinics. And these designations are important for us to know because people living and residing and working in these designated areas of underservice are more likely to be living in poverty than those in non-designated areas and are more likely to have barriers to accessing healthcare. So just quickly, I'll define a HPSA and an MUA. So a HPSA is a health profession shortage area. So a HPSA can be a geographic area, it can be a population or a healthcare facility. And the federal government measures HPSAs in terms of shortages of either primary care providers, dental providers, or mental health providers. And they actually come up with a score. And the scores for primary care and mental health providers range from 1 to 25, and for dental health providers from 1 to 26. So the higher the score, the greater the priority, the more significant the need, the more significant the shortage in that area, whether it's geographic, population, or facility. You can see my source at the bottom there. You can go onto the HRSA website, it's hrsa.gov, and you can search a county, you can search a healthcare facility, you can search an address and you can determine if it has one of these designations. So I looked up two just to give some examples, and I picked a rural community and an urban community. So an FQHC in Bayfield County, Wisconsin, which is a rural community. FQHC is a federally qualified health center. So Lakes Community Health Center in Wisconsin. So their HPSA scores for dental providers is 20, for primary care 10, and for mental health 21. So we can see that at this FQHC, there's a more significant need for dental or mental health providers, but there's still also a need for primary care providers. And then I looked up Project Home, which is also a federally qualified health center, but in the heart of urban Philadelphia, where my office is. And we can see that they have a dental score of 25, primary care 11, and mental health 6. So similarly to the rural community, a very significant need for dental providers, but not as significant of a need for mental health providers there at that specific site in Philadelphia. So the other important designation to think about in addition to the HPSAs is a medically underserved area, an MUA. So an MUA is either a geographic area or a population with lack of access to primary care services. And the way the score for an MUA is calculated, it's called the Index of Medical Underservice. And so the scores range from 0 to 100, and anything 62 or below qualifies that area or population as a medically underserved area. And some of the ways those scores are determined are the ratio of providers to population, the percentage of the population at the federal poverty level, the percent of the population 65 or over, and infant mortality rate, among some other factors. So all of this leads us to probably why you're all here, is to think about, is there ways for me to help fund my education? So there's kind of, I'm going to talk about kind of 4 chunks of incentives for underserved service. So for providing care in underserved communities in these HPSAs or MUAs, I'm going to talk about kind of 4 categories of incentives. So the first one that I'll talk about are federal HRSA, again, Health Resources Services Administration, loan repayment programs. And then there's also federal HRSA scholarship programs. There are a variety of other federal sources of loan repayment. And then there are also state-specific loan repayment opportunities. So I'll go through each one of these and talk briefly about each one. So the federal HRSA loan repayment programs, there are 4 main programs under this Health Resources Services Administration. The first one is the Nurse Corps Loan Repayment Program, specifically for careers in nursing. There is the National Health Corps Loan Repayment Programs. I'm going to talk about those in a little bit more detail in a bit. There's the Substance Use Disorder Treatment and Recovery Loan Repayment Program, which is specifically for providers who are working within the population experiencing substance use disorder. And there's also a faculty loan repayment program, again, for those who are pursuing faculty or in faculty positions. So those are the main categories of HRSA federal loan repayment programs. There's also federal HRSA scholarship programs. So again, there's the Nurse Corps Scholarship Program, again, specifically for those pursuing careers in nursing. There's a Native Hawaiian Health Scholarship Program. And there's also the National Health Service Corps Scholarship Program. You'll see there's the National Health Service Corps Scholarship here, both in the scholarship program and in the loan repayment program. That's definitely the largest of these HRSA programs. And I'm going to talk more in detail about those as I go through the presentation. I'm not going to really go into detail about the Nurse Corps Scholarship Program or repayment program or the faculty or substance use disorder programs, but I will tell you later on where you can find information about those if you're interested in those specifically. There's also a number of other federal sources of loan repayment. So the one that we're hearing a lot about in the news is the Public Service Loan Forgiveness Program. There's also a number of NIH research-based loan repayment programs. A few examples of those are there's the AIDS Research Loan Repayment Program, a clinical research loan repayment program, a pediatric research loan repayment program, and others. The Indian Health Service has its own loan repayment program, and there's also a CDC loan repayment program for health professionals. Just so that you're aware of, there is a variety of these. They all have their own requirements and competitive nature and specifics on what can and can't be included in these programs. The majority of states also have specific loan repayment programs. Where I work in Pennsylvania, there is a Pennsylvania loan repayment program. So to find that, how could you find those in your own state? Every state has something called a primary care office, and that's a great place to start if you're looking specifically to see if your state has loan repayment programs. So this website here is on the HRSA.gov website. Again, your state primary care office, you can scan that QR code, or you could just Google your state primary care office, and I'm sure you'd be able to find it. So I'm going to talk a little bit about this National Health Service Corps that I mentioned previously that has both scholarship and loan repayment opportunities. So it is through HRSA, the Health Resources Services Administration. It was established in 1970. And as I said, it does offer both scholarship and loan repayment programs. So I'm going to go into a little bit of detail about this National Health Service Corps Scholarship and Loan Repayment Program, just to give you an idea of what some of these programs look like if you're considering exploring them. So I'm going to talk first about the National Health Service Corps Scholarship Program. So this program can provide payment for up to 4 years of education for tuition and fees and what the federal government refers to as reasonable educational costs. It also can include a monthly stipend, which for the 2021 academic year was just over $1,400 a month. There is a 2-year minimum commitment for this program, and it's a 4-year maximum. And focusing on one of the following approved specialties. So family medicine, general pediatrics, general internal medicine, OBGYN, or psychiatry. So obviously a focus on primary care specifically. So after residency, it's required to choose a practice site that's on the list of approved sites that is maintained by the National Health Service Corps. And again, separate from that scholarship, compensation and salary is negotiated directly between the clinician and the site. So this scholarship is not in place of or in lieu of salary. This is an additional benefit in exchange for providing care in these HPSAs, MUAs, and these underserved communities. To apply for the scholarship program, some general requirements. U.S. citizenship is required. The applicant must be either accepted or already enrolled in medical school, an NP program or a PA program, a nurse midwife program, or dental school. The application cycle tends to open early in the year. About 10% of applicants are awarded this scholarship, so it is highly competitive. You can see the statistic here. Over 1,800 tend to apply and approximately 190 are selected. It is an online application process at this HRSA.gov website, and typically the award payment is later in the year, around November. So that scholarship, once the applicant, the awardee, has completed their training, as I said, will choose a practice site in a HPSA identified as having the greatest need. So looking at those HPSA scores, there is an approved National Health Service Corps list. And it is also possible to have a site approved that is not on that list. There's a separate process to do that. If you don't choose a site, one will be chosen for you, and you will be assigned one. So there is both a full-time and a part-time option for this. So it's full-time, a minimum of 40 hours a week, or a part-time option and just lengthening the amount of time. So for all of these scholarship and loan repayment opportunities, it's important to keep in mind that these are very serious commitments and come with pretty significant consequences for breach of contract. So if a student accepts an NHSC scholarship and does not complete their academic program, they're obligated to repay all of the funds that have already been received. If upon graduation, there's a breach of contract either for not complying or not being in an NHSC approved site, the awardee can be liable for financial damages equal to 3 times the amount of the scholarship and the stipend plus interest. So pretty significant consequences for not holding up one's end of the contract. So now I'm just going to talk a little bit about the National Health Corps Loan Repayment Program. So we talked about the scholarship, where that's kind of you're getting your training paid for. This is a loan repayment. You have taken out loans to pay for your education and training, and you're looking to have some of that loan repaid for you. So the loan repayment program through the National Health Service Corps does require a minimum of a 2-year commitment with full-time practice. There is, again, like the scholarship, a part-time option, twice as long for the same amount, or the same time for half the amount. So kind of the same ratio either way. The money that is received through the loan repayment program is made as a payment to the recipient, not to the loan holder. But it is exempt from gross federal income taxes. So interestingly, the amount that one is eligible for through this federal loan repayment program is tied to the HPSA score, to the degree of need of the site. So sites that have a HPSA score of 14 or above, the repayment is available for up to $50,000 for a 2-year commitment. For HPSA 13 and below, it's up to $30,000 for that 2-year commitment. So certainly a higher incentive for those who are interested in providing care in communities or populations or facilities that have the most need. So the loan repayment application typically opens in the winter and closes in March. If one is applying for those higher need sites with that higher amount limit, the higher HPSA score, those get responses in about 12 to 16 weeks, so a fairly quick turnaround for a federal government process. For those with a HPSA score, if you're applying for a site with a HPSA score of 13 or below, those applications are held. Priority is given to those applications with higher need, and then depending on available funding, those awards are given out to those applying for sites with 13 or below for their HPSA score. So to be eligible to apply for the loan repayment program, one must be a United States citizen, and completion of training in one of the approved primary care categories listed here. So family medicine, pediatrics, internal medicine, geriatrics, OBGYN, or psychiatry. So this one does include psychiatry in the list of eligible professions. You must have a full permanent license in the state of practice and either be already working at an approved site or have accepted an offer of employment to begin employment at an approved site within 60 days of the application. So the site is tied to the application for this loan repayment program. Again, if we're thinking about consequences of breach of contract, so if there is a failure to complete the obligation by the awardee, there is a requirement to repay any amount paid for uncompleted months, plus a penalty plus interest. So again, really severe and significant consequences financially when we're thinking about fulfilling the obligation of these contracts. Excuse me. So part of the competitiveness to apply for these programs is a demonstrated commitment to providing care to the underserved, to providing care in these MUAs and HPSAs. So if you think that you might be interested in working in an underserved community, AHECs all across the country have something called the AHEC Scholars Program. The AHEC Scholars Program is a 2-year interprofessional program for health profession students that focuses on things like cultural competency, social determinants of health, integrated behavioral health, and could really help you as a health profession student determine if working in an underserved community is something you're interested in. If you are interested, it can certainly help you increase your skills to be prepared to provide care in an underserved community. So there is a QR code here. If you scan that, it will take you to the website of the National AHEC organization. So they represent all of the AHECs across the country. There's an inquiry form that you can fill out if you're interested in learning more about the Scholars Program, and it will direct you that your contact information, will be shared with your state's AHEC, who can then connect with you and learn more about the specific Scholars Program in your state. So here's just some, as I wrap up, just some contact information and resources that might be helpful for you. So here is my name and email. Feel free to contact me if you have any questions or looking for additional resources about loan repayment or the Scholars Program. This QR code in the middle of your screen can help you find your local AHEC. So your local AHEC can, as I said, connect you with your local Scholars Program. They usually have information about any state-specific loan repayment opportunities that might be available. Many AHECs can assist health profession students in identifying or being connected with community experiences, particularly in underserved areas. And then if you look at the QR code on the bottom right of your screen where it says NPHC resources, if you follow that website, it will take you directly to the National Health Service Corps website, where it outlines all of the information about all of these loan repayment opportunities, how to apply, when the applications are due, and kind of the minutia of detail that it would be kind of too much for a presentation here. So I am going to stop sharing my screen, I believe, and I believe we have some time for questions. And I would just encourage all of you to explore these opportunities, particularly if you're interested in working in an underserved communities. There's a lot of support and loan repayment and scholarships specifically for folks who are interested in practicing in these communities. So I highly encourage you to explore those opportunities. So I'm happy to have some time for Q&A.
Okay, so now we will begin the Q&A. I'm going to pull up the questions in the chat. So the first one is, does your organization offer only national student opportunities? Are there any opportunities for international students?
That's a great question. So I would connect with your local AHEC for that. So at least at my Southeast Pennsylvania AHEC, we would not exclude students who are international students from participating in any of our sponsored programs. So we would welcome international students into our AHEC Scholars Program in Southeast Pennsylvania. Certainly these loan repayment programs, the majority do require US citizenship to participate or to apply for those. But I would check with your local AHEC to see what programming they specifically offer in your region, because that's probably going to vary region to region.
Okay, great. The next question is, in relation to HPSA, would specialties related to surgery apply to this as well?
So for these loan repayment programs, they do focus specifically on primary care. So things like OBGYN, pediatrics, internal medicine, geriatrics, family medicine. They typically don't, specialties or subspecialties are not included in these loan repayment programs. Some of the research-based ones are more specific, but these programs were really focused on increasing access to primary care and kind of responding to the shortage of primary care providers in these underserved communities.
For the National Health Services Scholarship Program, can you apply even in your senior year in med school? How many times can you apply to it?
The scholarship program, I believe, is a minimum of 2 years. I do, however, think that there is a special 4th year program, but definitely something that I would encourage you to apply for as soon as possible, because it does have up to 4 years included. So if you know that this is a path you're going to take, if this is something you're interested in, if you're committed to, upon completion of your training, working in an underserved community, then I would say the sooner the better to maximize that amount of scholarship.
Does the scholarship cover our living expenses too? Is this scholarship given one time or renewed every year? Is this scholarship given directly by the organization or any other process?
So there is a living stipend associated with the scholarship. I believe it for the 2021 academic year, it was around $1,400. So depending on what part of the country you're living in, may or may not cover monthly living expenses. Again, it's up to 4 years. And it's paid annually.
To follow up on a previous question, are there any opportunities for those interested in pursuing surgical specialties down the line?
So there aren't any that I am aware of. I would encourage you to, you could probably do some research online. If you want to contact your local AHEC, you can even contact me and I'm happy to explore that with you. I'm not aware of any opportunities specifically, but there may be. So feel free to reach out to me or your local AHEC and we can help explore that option with you, see if there's anything out there.
How many times can we apply? And can we reapply the next year if we get rejected, or is there a limit to how many times we can apply?
So you can reapply if you're within meeting all of the other qualifications. As I said, it is a very competitive program. About 10% of applicants are awarded that scholarship. So I would absolutely encourage somebody to reapply. For the scholarship, some things that can help make an application more competitive is a demonstrated interest in primary care and a commitment to working with underserved communities. So perhaps volunteer work, or in general, maybe participating in our scholars program, showing a demonstrated interest in both primary care and underserved communities. For the loan program, for the repayment program, a very similar letters of recommendation, a CV are required, a commitment to primary care in underserved communities. For the loan repayment program, they also ensure that awardees have fulfilled any other financial or service obligations that they may have. So if somebody has unpaid child support or other financial obligations that haven't been paid, that could be held against them in their application process.
How many sites can we apply to, and can we reapply? Oh, never mind, that was the previous one. Sorry, so the next one is, does this count if you completed a dual residency in family medicine and psychiatry?
Yes, yes. So both of those are on the list for the loan repayment program. So absolutely would be eligible. And so for that loan repayment program, you need to be employed at a site or have a contract to begin work at a site that's on that National Health Service Corps approved list, which you can find on the National Health Service Corps website. Which I highly encourage all of you to take a chance and explore. It's actually really fun. You can put in, as I said, a facility, an address, a county, and it'll give you all of the scores. There's also a list of employment opportunities. So let's say you know that you want to practice in California or Pennsylvania or Michigan. You can take a look and see what employment opportunities are available at these sites in that region. So you'll get an idea of the demand and the need in your area. It's a lot of fun too. If you're a data person, I highly encourage you to go play around. It's a fun site to look at.
Is your organization on Instagram? And if so, what's the handle?
So I would, we are Southeast PA AHEC, but I would encourage you, we're not the national AHEC organization. I represent Southeast Pennsylvania, which is Philadelphia and kind of the bubble around Philadelphia. Thank you, Alexia, for putting that in the chat. But that's just our regional AHEC. So if you connect with your regional AHEC, whether you're in Eastern Maryland or Texas or wherever you are in the country, you'll have a regional AHEC that you can connect with. Most of the AHECs are well connected to the medical schools and other health profession schools in the area. And each one of them are their own unique organization and have their own social media, websites, and programming. So I really encourage all of you, lots of opportunities available at your local AHECs.
If we want to stay working with the underserved area slash population even after loan repayment help, can AHEC help with finding a job in these communities?
Absolutely. So I would look at that job finder on the HRSA NHSC website. There's lots of opportunities there, but absolutely, if you're interested in career opportunities either tied to scholarship and loan repayment or outside of that, your local AHEC can absolutely be a resource in connecting you to the health centers and providers and opportunities in your community.
Are similar loan repayment programs available for private loans used to pay for tuition?
I'm sorry, Alexis, can you repeat that question again?
Yes. Are similar loan repayment programs available for private loans used to pay for tuition?
So there are a number of loan repayment programs. So I would encourage you to kind of look at each one. I'm not sure about the status of the funding source. So you would probably have to go to all of those, look at that HRSA website, look at those descriptions, and that's probably kind of in that fine print there of what loans are or are not eligible for repayment or scholarship opportunities.
If there is a student who doesn't live in the Pennsylvania state, what are the opportunities that your organization is offering?
Yeah, so we're the Southeast PA AHEC. We cover the Philadelphia region. There's actually 7 AHECs in Pennsylvania. There's AHECs in, I believe, every state except for Delaware. If you're in Delaware, you can reach out to me because we're pretty close to Delaware. But if you go to the National AHEC organization website, yeah, for Delaware, right, Alexia? And just long story short, it's because Delaware actually doesn't have a medical school, and AHECs have to be tied to medical schools to receive their federal funding. But if you go to the NAO, the National AHEC Organization website, you can look up your local AHEC, and then you can see the contact information, a link to their website, what programming they have available. Everyone's a little bit different, but we all have a scholars program, and we all have some sort of opportunities or community experiences for health profession students.
As an undergrad, apart from AHEC scholars, AHEC scholars, are there any direct or indirect opportunities you recommend or know of for students who want more experience and exposure working in underserved communities? Thank you.
Oh yeah, absolutely. So I would look for volunteer opportunities. Most universities have a person who can coordinate service or volunteer hours, so I would look into that. If you're in a health professions program, check with your faculty. They might know of opportunities specifically in the health field that might be of interest to you. I strongly can't encourage enough volunteerism, service opportunities. All of that is going to not only make any applications for graduate education or employment more attractive, it's also going to help everyone grow and become better individuals and professionals as we go out into the field.
Are these loan repayment programs for education loans from the government, or can we pay off private loans we took out for education too with it?
So that question came up earlier. I would check each loan repayment program may have its own guidelines as to if they will allow repayment of private loans or not. So I don't have a specific answer to that. I would encourage you to kind of look at those applications and explore if those loans are included or not.
Can you please share with us the link to connect with the International AHEC organization? Thank you in advance.
Sure. Actually, I'm going to just reshare my screen really briefly. And let's see here. go to the end. I have so if you look at this, these QR codes, so the one in the middle of your screen, if you follow that, that will take you to the website of the National AHEC organization. And you can punch in your state or your zip code. I'm not sure exactly what query it uses, but it will help you find your local AHEC. And then the QR code here on the right is for the National Health Service course. So that will take you to a page that outlines these HRSA federal scholarship and loan repayment opportunities. It'll link you within that to descriptions, application information, kind of the nitty-gritty details that are required for each of them. And then I will just share this other QR code with you, which is for the Scholars Program. If you scan that, it will also take you to the National AHEC organization website, but it will take you to a form that you can fill out to just basically say that you're interested in learning more about your Scholars Program. What will happen with that is it will go to a national office who will then forward your information to your local AHEC, who will then connect with you, talk to you more about their specific program and how to apply. So each state runs their own individual scholars program.
What are the best ways to reach out to you?
So I will put my email address in the chat. Feel free to email me or contact me. If that's easier, you can do that, or you can search your local AHEC or go to that National AHEC organization website for more information.
Are you aware of any scholarships related to music and med school scholarships?
To music and medical school? I am not. I think that would be really fantastic. The ones that I've presented today that we focus on at AHEC with our focus on primary care and underserved communities, those are specific programs for folks who are planning on pursuing careers in primary care and who are interested in working in those HPSA or MUA underserved communities.
Are there AHEC programs for current undergrads?
There are. So depending on your AHEC and the programming they offer, you may be eligible for the Scholars Program. Again, every state manages their own unique Scholars Program. They all share the same core values and topic areas. So every Scholars Program will focus on things like cultural competency, practice transformation, social determinants of health, the same core topics, but everyone implements it. Each state can implement it a little differently. So for example, the Pennsylvania AHEC Scholars Program, certain undergraduate programs are eligible to apply and participate in the Scholars Program.
How should pre-health students prepare to make financially smart decisions regarding taking out loans?
That is a really great question, and we could probably have a whole speaker for an hour about that. So I think kind of long story short, the best advice is to understand all of the options and to really understand the opportunities and the obligations of all of these programs. Some of these programs can really provide tremendous financial assistance to support health professions education, but they also come with significant obligations. So for example, receiving a scholarship, you are agreeing perhaps in your first year of medical school to provide primary care services in an underserved community. So that really needs to be an obligation that you take seriously and fully understand and are able to commit to, because there are significant financial consequences to not fulfilling your obligation. And I would say that about, any financial literacy or kind of understanding, all of that is really understand both the opportunity and the obligation. Take your time to read all of the fine print on applications, on contracts. Don't be afraid to have another person read it, maybe a family member, maybe a faculty person at your academic institution. If your family has someone who helps with their taxes or finances or a financial advisor, but don't be afraid to take your time to really understand not only what the benefit is, but also what the obligations are.
Thank you for answering all those questions and for your presentation today. Next up, we will have our sponsor expo. At this expo, attendees can learn more about the products and services offered by organizations financially supporting NPHC. Make sure to check out all the booths.
Great, thank you. Thank you everyone for being here. Thank you for the wonderful questions. We will have a booth at the expo today and Friday, so feel free to visit me or my colleague who will be there today. So thank you all so much.